Hello and welcome to this session, Learning Outcome LO3. Understand the effects of radiation on living cells and methods for monitoring radiation exposure. Today, we will learn how radiation impacts living cells. This session will explore the biological effects of radiation and the methods used to monitor exposure. We will also examine how healthcare and nuclear medicine manage these challenges to ensure safety and minimize risks. Radiation affects cells through direct and indirect damage. Direct damage involves breaking DNA strands, causing mutations or cell death. Indirectly, radiation creates free radicals from water molecules, damaging DNA and proteins. Tissues with rapid cell division are more sensitive, leading to cancer or cataracts. Short-term effects include skin reddening and nausea. The type, dose, and energy of radiation influence biological effects. Tissue sensitivity varies, with bone marrow being more vulnerable than muscle. Age and health also affect radiation response. These factors help predict risks and set exposure limits. Understanding these principles is crucial for healthcare safety. Radiation monitoring ensures safety in nuclear medicine. Personal dosimeters track accumulated exposure. Devices like film badges and electronic dosimeters provide real-time data. Area monitoring detects contamination and equipment leakage. Records ensure exposure stays within legal limits. Alpha particles are large and heavy, causing severe damage if internalized. They break DNA strands directly, leading to cell death or mutations. Inhaled or ingested, they pose serious risks to lungs and digestive systems. Despite limited penetration, their energy deposition is intense. Alpha radiation is dangerous when inside the body. Beta particles are smaller, penetrating deeper than alpha particles. They cause both direct DNA damage and indirect effects via free radicals. Prolonged exposure can lead to burns and increased cancer risk. Internally, beta emitters damage specific organs. Their moderate penetration makes them less concentrated, but still harmful. Gamma rays are highly penetrating electromagnetic waves. They spread energy widely, mainly causing indirect DNA damage. High doses destroy cells, while lower doses increase cancer risk. Used for imaging, they require controlled doses to prevent harm. Gamma rays' deep penetration makes them effective yet potentially dangerous. Neutrons penetrate deeply, interacting strongly with cell atoms. They create secondary charged particles, causing severe ionization. This results in intense DNA breaks and cell death. Neutron radiation is one of the most damaging forms. Its high biological effectiveness requires careful management. Somatic effects occur when body cells are damaged by radiation. These effects are limited to the exposed individual. Short-term effects include skin reddening and nausea. Long-term effects may lead to cancer and organ damage. The severity depends on dose and tissue radiosensitivity. Hereditary effects occur when reproductive cells are damaged. Mutations can be passed to future generations. The exposed individual may not show symptoms. Potential effects include congenital abnormalities and genetic disorders. Only germ cell damage leads to hereditary effects. Absorbed dose measures energy from radiation absorbed by tissue. It is calculated using energy and tissue mass. Exposure is estimated by dose rate times time. This helps determine radiation received over a period. Understanding these calculations is essential in healthcare. RBE compares effectiveness of different radiations for the same effect. It uses doses of reference and test radiation. For example, neutrons may be more effective than X-rays. RBE helps assess radiation risks. It's similar to radiation weighting factors in dose calculations. Equivalent dose accounts for different radiation's biological effects. It uses absorbed dose and radiation weighting factors. Different radiations like alpha and gamma have varying effects. This calculation helps assess radiation risk. Equivalent dose is measured in sieverts. Effective dose considers tissue sensitivity to radiation. It uses tissue weighting factors and equivalent dose. This calculation provides overall risk assessment. Effective dose helps inform safety measures. It's crucial for understanding radiation impact on the body. A patient receives gamma rays and alpha radiation. Equivalent doses are calculated for lungs and bone marrow. Radiation and tissue weighting factors are applied. The total effective dose is determined. This example illustrates dose calculation in practice. Radiation monitoring prevents excessive exposure. Personal dosimeters track individual doses. Area monitoring ensures environmental safety. Accurate records help maintain legal dose limits. Monitoring is crucial in healthcare to protect workers and patients. Radiation protection minimizes health risks. Dose limits are set for personal and genetic safety. Somatic and hereditary effects are considered. Protective measures ensure safe radiation use. Understanding these principles is vital for healthcare workers. Radiation is used in diagnostics and therapy. Understanding effects helps manage exposure. Procedures must balance benefits and risks. Monitoring ensures doses stay within safe limits. This approach protects both patients and healthcare staff. Long-term radiation effects include cancer and genetic changes. Tissues with rapid cell division are more vulnerable. Monitoring and protective measures reduce risks. Understanding long-term effects aids in prevention. This knowledge informs safe radiation practices. Short-term effects include skin reddening and nausea. High doses over short periods cause acute effects. Monitoring helps prevent excessive exposure. Understanding these effects is crucial for immediate safety. Short-term effects guide emergency response in radiation incidents. Regulations set legal dose limits for radiation exposure. They guide safety practices in healthcare. Compliance ensures protection for workers and patients. Understanding regulations is essential for radiation safety. These laws minimize risks and promote safe radiation use. In conclusion, each type presents distinct risks, which inform and shape appropriate radiation protection strategies. If you need support, reach out via WhatsApp at 07484361688. Our team is here to help. Thank you and see you at the next session.